Welcome to the Seldinger Technique instructional video. The Seldinger Technique was first described in 1953 by Sven Ivar Seldinger, a pioneering Swedish interventional radiologist. Prior to this procedure, sharp large bore trocars were employed to gain arterial access, resulting in a high rate of complications and limiting its use to a larger artery. While working at the Karolinska Hospital, he introduced a novel method of gaining vascular access using a hollow needle, exchange wire, and catheter, which enabled radiologists to perform angiography in a relatively risk-free manner, and thus led to the emergent minimally invasive procedures. The Seldinger technique is a method for catheterization of vessels. Developed in 1950, is still popular today. And it's a method of percutaneous entry for arterial and venous access. The preferred top three vessels are the femoral artery because of its size and accessibility. We can also utilize the brachial artery, and if need be, the popliteal artery. The prerequisite to choosing the preferable artery will be based on a strong pulse and the absence of disease. The method that we gain access to our preferred choice would be by cleaning the site in a sterile fashion. We drape the area of interest within a sterile manner, and we also provide the patient with local anesthetic. The Seldinger technique, step by step, we start with an insertion of a needle, placement of the needle in the lumen. We insert a guide wire through the needle and advance 10 centimeters. We remove the needle, leaving the guide wire in position. We thread the catheter over the wire to the area of interest using fluoroscopy guidance. And then we remove the guide wire, leaving the catheter in place. Here is a cross-sectional diagram of what that would look like in real time. As you can see, we have the epidermis, dermis, subcutaneous tissue, and then we have the artery. So the insertion of the needle goes right into the artery or vein. Then we have the needle in the lumen of the vessel. We insert the guide wire, the removal of the needle. We take out the needle, we thread the catheter over the wire, and then number 6, removal of the guide wire, and now we just have the catheter inside the artery. The two less common methods of arterial venous access is cut down, a minor surgical procedure to expose the vessel of interest, which is very invasive. And the second is translumbar. The patient is prone, and we access the aorta through T12 and L2 into the aorta. This is a quick view of the Seldinger technique. Thank you.